The twisted voal appearance of the crown makes it naturally thinner and the most transparent area of the scalp, even in those who are not balding. A sizable bald crown, on the other hand, evokes a sense of apprehension, a sense of bewilderment, consternation, and at times dread. And in the very young, a sense of impending contingency and foreboding. On seeing a large bald crown, on the other hand, the surgeon evinces a sense of heightened scrutiny and various variables of scalp integrity come to his mind and he proceeds to assess them like donor density, characteristics of hair in the donor area, the permanent zone of the donor area, presence or absence of miniaturization, the age of the patient, the family history of baldness in the patient, whether the patient has rational expectations from his procedure, and an assessment of whether the patient will be compliant in future to hair loss medication because baldness is ever progressive. These factors form an integral part of the probing assessment that the surgeon subjects his patient to, the patient who is having a large bald crown. For a large bald crown in a patient having unrealistic expectations from the surgery is very unsettling to the hair transplant surgeon. So to put matters in perspective, I have 3 case studies, one of which is this patient, a young patient who has extensive baldness, aggressive baldness in a setting of limited donor supply, though he has realistic expectations and is willing to take DHT blockers in the long term. So when you have a limited donor, a thin donor, so this is the expectation from a result. Many patients would not like this result. Many patients who have unrealistic expectations and who have seen routinely very high densities being provided on the internet would say this is a subpar result. But the very reason to bring these case studies to you is to explain to you that every patient does not have similar resources available as the other patient to give a head full of hair. Another patient's result cannot be replicated. Your result will be unique to your existing circumstances, for you have to play with the cards that you have been served. Now in this patient, many patients will say, wow, what a good result. But they forget to see that as compared to the earlier patient, this patient has a lush donor area. This patient is young. The hair shaft diameter of the donor hair is fantastic. And then the patient has been taking DHT blocker for a long time. His baldness has not progressed. So therefore, he continues to enjoy a great looking result. And this Caucasian patient, who for last 7 years has had 3 hair transplant procedures in the face of very aggressive balding, a thin donor supply, but he is committed to taking DHT blockers in the long term and still continues to enjoy a head full of hair even though his baldness is ever progressing. So in hair transplant, especially for crown area, having realistic expectations is a very important prerequisite before you contemplate a hair transplant. So if you have recently started researching about a hair transplant for yourself, it is important for you to know the limitations under which the hair transplant is done, especially if you have extensive baldness and more so if you are young. The crown is ad nauseum referred to as a moving target. Well, there is a lot of inherent wisdom to this phrase being used for the crown. Nobody uses this term for the hairline. While one procedure in the crown may address your present circumstance and you might have good coverage, but it does not mean that more areas will not appear. The crown expands circumferentially and it continues to do so, especially if you're young and with extensive baldness or a strong history of baldness in your family. Crown baldness always tends to be progressive and this is right on your face. When it's a hairline, you can easily camouflage it. Baldness occurs behind the hairline and there are enough ways to conceal these balding areas in the temples or in the mid-scalp when they happen. But this cannot be done for the crown. In crown, it's on your face. You can see the crown enlarging, gradually a halo appearance appearing around the planted area, or as we often call it, the island effect. And if, God forbid, you have given very high densities in the center, and you cannot replicate this high density in the periphery, the whole objective of a gainful hair transplant, a hair transplant that looks aesthetic, is lost forever because your grafts are not limitless. There is only a finite donor area, whether it is the scalp, whether it is the body hair, or various other resources. There are various myths that have over a period of time accumulated regarding the crown. Why hair transplant, as people feel, does not work in their minds for their crown. And these are: number one, that the crown does not have sufficient blood supply. The crown is high up in the head, and therefore the pressure of blood in this area is not sufficient to grow hair. Well, that is so far from the truth. The scalp blood supply is so much, it is 7 times as compared to any other part of the body, and that is sufficient for hair to grow. The second myth that people talk about is that the crown has high DHT levels, therefore hair do not grow in the crown. Well, skin biopsies have not proved this myth to be correct. And then very commonly said that the crown is the black hole of grafts. Well, that it is, but for a reason. And lastly, that the doctors who do hair transplant have not yet mastered the art of filling in the crown area. So these are the myths which people gather over a period of time, hearsay, gathered from the forums, gathered from talking to other patients, and they are so far from the truth. Before asking a doctor to fill your crown with very high density, ask yourself this question: if I transplant all available good quality grafts in my crown area, and if, God forbid, baldness progresses extensively over a period of time, how will I look? A very full crown area with a halo of baldness around it as baldness progresses, a bald shining mid-scalp, and an absent hairline is not what we usually see in nature. If you fill your crown with high density, you have forever killed your long-term goals and objectives. It is like falling from the frying pan into the fire. So to conclude, hair transplant is not about mindless harvesting of grafts, catering to your every whim and fancy about density in the crown area, but is a skill and art of strategically placing available donor supply in a setting of limited assets where your liabilities abound, where with limited resources at our disposal, we try and achieve a sense of illusion with available grafts where baldness is ever progressive, ever evolving, in the face of a continuously depleting donor. Once you have understood these facts that I have brought forth to you in this video about crown coverage and how we try and create an illusion of fullness with our hands tied behind our backs, you will realize the limitations of hair transplant and will not fall prey to these myths that abound about crown hair restoration. Well, thank you for watching my video, and if you liked my video, do let me know, and if you have any questions, I'll be very happy to answer them. Just drop a comment in the comment section below. Thank you for watching.